Hey guys, this is Manu, Kalia, physical therapist and Ayurveda herbalist. So I'm going to answer a question that a bunch of you guys have been asking me about foot-related problems, from plantar fasciitis to Achilles tendon issues, especially for you runners. I got a few of you runners who have been asking this question to go over some key causes of these problems. So I'm going to go over one major component that I often find is overlooked when looking or assessing for these problems. And not just these foot-related issues, but lower leg problems and all the way up the chain. And we're going to talk about mobility of the big toe, and just more specifically, your first MTP joint. Okay, so we're talking about this joint right here, which is your metatarsophalangeal joint. So this is right here. So the big toe. And this is not the part we're talking about, this joint here. The distal joint, we're talking about this joint right here. How much extension does this joint have? Okay, so if you're lacking extension in this joint, it's going to impact how you are able to walk and how you're able to run. So, for example, if I am standing and I'm going to bear some weight through that joint, and I shift my weight forward, I need to have enough extension in that big toe. You pay attention right here. If I'm missing that range of motion in that big toe, what am I going to do? I'm going to work at, as I'm trying to go over, I don't have enough range, I'm going to change the way I move. So I might bring my foot outwards or inwards. More often than not, I'm going to bring it outwards. So I might get a little bit, possibly even more pronation or overpronation, or possibly a flat foot position, where I'm going to change mechanics all the way up the chain. Loading up the tendon differently, more inside knee issues, patellofemoral problems, so all sorts of things, and just reducing efficiency and your performance, because I just can't get over that foot properly. Okay, so, and a couple of components having to do with that are, one major part first is I gotta make sure that I have enough extension in that joint, range of motion. So normal is around 80 degrees or so. Okay, so I have more than enough range of motion at that joint. Okay, so first you gotta make sure, do I have enough range of motion at that joint, enough flexibility at that joint? So joint mobility, and the second part is we want to see, does the plantar fascia have enough mobility too, or are there restrictions along that fascia? So remember, your plantar fascia is just this thick band that runs at the bottom of your foot or through this area, which is giving you arch support. With your muscles, all your foot muscles too, as well as big toe muscles. It gives stability to that foot. Shock absorption, ability to push, accept load, as well as push off. Okay, so if this is too tight, it's going to change things also up the chain. So for testing it, if the plantar fascia is too tight, we're going to look at, I'm going to sit down right here, and all I'm going to do is I'm going to shift my weight forward a little bit. So I loaded up the foot, especially that forefoot right through here. Now that forefoot is loaded up, and all I'm going to do is I'm going to grab my big toe, and I'm going to see if I can raise it up, if I can lift it straight up, right? How much tension is there as I'm lifting up that big toe? And you compare it to your left versus your right side. So in this position, remember, as the foot is loaded up, a lot of the restrictive structures are that plantar fascia. If it's just too tight, it's not going to let that big toe come up as easily. Okay? Because remember, we checked it already when I am in passive position. I have good range. So the one other structure that could be limiting it is my plantar fascia, possibly some of the other soft tissue and some other structures too. So I checked and I see that, okay, when I bring it forward, load it up, and I try to raise it up, I got to get about 30, 40 degrees or so. If I can't, and if I'm stuck down here somewhere, just can't even bring it up, then you know once you're standing and walking and running, you're loading it up, it's just way too stiff through there, okay? So third thing I'm going to do is I get in here and I kind of feel around and I see, do I hit any sticky spots? Is it tight somewhere? Is it painful? Is it sore? Okay? When I find those spots, those tight spots there, I'm going to use a lacrosse ball. All I'm going to do is put this here and just kind of work at freeing up that tissue. I might go up here, different spots, and let's say if I find a spot, maybe I find a spot on the inside more, and I'm going to work at bearing some weight on it and just roll back and forth or in circular fashion or out through here. and just kind of break up the thickening and those adhesions that might be there. Free up that tissue, mobilize it. It's just too hard to stretch that tissue, okay? And that will help relieve some tension also, okay? For the joint itself, you might have to mobilize that joint. That's a whole other video. And for strengthening and motor control, balance issues with the foot, and targeting the muscles, that's another video too. So I'll post some more of those also for you guys. All right, hope you found that useful. Make sure you click on the link to check out my site. I have tons of information on it. Subscribe to the channel, and if you have any questions, leave a comment and I answer all my questions. Thanks.